Hello, my name is Adam Riedel. This is my BSN225 drawing insulin medication video. For this I need a few things: some gloves, some alcohol swabs, some regular insulin, and some short-acting insulin, and hand sanitizer or something to wash my hands, and then my insulin syringe and needle, so 29 gauge. It's also a half inch and it's a milliliter syringe, but we're going to be using the units that are on this. So what I'm going to do first is verify the MAR and the provider's orders and make sure that I'm on the same page as them, and I see that they want 4 units of regular insulin and 8 units of NPH, or the short-acting sub-Q, for both of those. And when I'm doing this medication administration, I want to be mindful of the 6 patient rights of medication administration, which are patient, right time, right medication, right dosage, right documentation, and right route. So I've got all of my things, and I'm going to go into the patient's room, knock on the door, go in there and get them their privacy. And since this is just a video about drawing the medication, I don't actually have like a patient or a person with me, so I would pretend right now to do a 2-patient identifier, so either their name and date of birth, and then I would ask them if they have any allergies to medications or food or seasonal allergies of that type. If they're going to say no at that point to me, hopefully. I'm going to then explain who I am, why I'm there. My name is Adam Riedel. I'm your nurse, and I'm going to first, for this, I'm going to be checking their glucose, ideally, because I want to make sure that they're not already like hypoglycemic. But ideally, I'd be checking their glucose prior to drawing up and administering insulin. So I would do that and explain why I'm giving them insulin for this, and that we would be monitoring their glucose throughout their stay. Offer the ability to have any questions or anything like that, and then go ahead and get started with everything. And I'm going to use some hand sanitizer and put my gloves on, and I'm going to re-verify in the EHR the provider's orders, which are 4 units of regular insulin sub-Q and 8 units of NPH sub-Q as well. So the first one that I'm going to draw is the regular insulin, and then I'm going to draw the NPH, but I'm going to inject air prior into the short-acting, and then inject air and then draw from the regular insulin, and then after that then just solely draw into the short-acting to get to my 8 or to my 12 units. So what I want to do first with both of my insulins here is roll them in the palms of my hands and just make sure it's all nice and good. And since these are both multi-dose vials, I would want to make sure in a real-life scenario to check the expiration, see if there's anything that's abnormal with both of these. And I actually should probably bring this down so you can actually see what I'm doing. So I just rolled these both in my hands, and I'm going to use some alcohol here on the tops of these, since they're both multi-dose vials. And we're going to go ahead and get started. So verifying again that the NPH is going to be 8 units. And so with the cap still on the needle, I'm going to get some air into this here. Okay, so that's there at 8. And when I do this, I want to make sure that I'm not touching the solution. So I'm just going to insert this vertically and inject my air. Perfect, and I'll take it out. And I want to verify again in the MAR that my regular insulin is 4 units, and indeed that is the correct dose. So I'm going to inject my 4 units of air into my needle, and I'm going to inject and also draw this up too. So I'm going to invert this and inject my air, and then draw up my 4 units of regular insulin, and then come out of the vial. And then I'm not going to re-inject any air, and then I'm going to invert the NPH solution and get to 12 here. And I want to just make sure that I don't have any air or anything, tap it for that. And indeed, we're sitting at 12. And that is how you draw insulin. And so if I were to inject this into my patient, this is how I would be injecting them. I would have my other alcohol pad to use that on their skin. So I'm going to actually just cap this with it in there right now, just since we're pretending. Put this in our sharps. And I would take my gloves off, use hand hygiene, and I would make sure I was documenting what I was doing if I was to administer that medication, and what I had drawn up. So thank you very much.